SOMOS, serving Oregon and its migrants by offering solutions. This is Wasco County, nestled at the base of Mount Hood and along the banks of the Columbia River. Spread over 2,400 square miles, it has a population of around 26,000 people. Agriculture is a large part of the economy, and along with Hood River County to the west with 28,000 acres, makes up 10% of Oregon's fruit, tree nut, and berry sales. We have over 600 farms, farming over 1 million acres just in Wasco County alone. And because of this, our migrant or seasonal farm workers are estimated to be around 20,000 on an annual basis by the Oregon Health Authority. SOMOS centers around the cherry harvest, an intense, focused harvest season that brings around 5,000 migrant workers in for 3 to 4 weeks, sometime between June to August, depending on the weather. Mid-Columbia Medical Center began the program in 2016, although they were unable to offer the event during COVID-19 pandemic. Mid-Columbia Medical Center is a nonprofit community health care system serving a rural population in 4 counties with a 49-bed hospital and numerous inpatient and outpatient services. MCMC is the largest employer in Wasco County. SOMOS partners with local orchard owners, local community partners, and orchard provides screenings and other resources for our migrant workers. Today, we're going to meet Stacy Cooper, owner of Cooper Farms. Cooper Orchards farms about 300 acres in cherries and 25 acres of pears and have been in business for over 152 years. Stacy takes a moment out of her day to talk about what SOMOS means to her farm and more about her operations and how much the migrant workers mean to the community. About how many migrant workers do you employ during harvest season?
We employ about 100.
And what do those migrant workers mean to your farm operation?
Everything.
Tell us about SOMOS.
The big event you had last year, I went off great. The events that you've had over the years with the diabetes and all the information has always been well responded to and appreciated by all of us.
Is there anything you think we can do more as a society to support our migrant workers?
Just realize how hard they work and just say thank you every day for what's on our table. And support them and make sure that they're well taken care of. For the weeks of harvest, SOMOS travels to the different orchards, between 3 and 5 orchards on an annual basis. And we offer migrant families health service such as blood pressure, blood glucose finger sticks, vitals, height, weight, and vaccines. They have the opportunity to meet with doctors, nurses, physical therapists, mental health counselors, and if during the screenings there is an indication of a more serious health concerns, clinic visits are actually scheduled at that time. Along with the medical services, they are also provided with hygiene kits, boxes of food, fun treats, and giveaways, resources, and printed information. Over 40 volunteers from all the partners come together in the late afternoon to set up the tents, put up the signs, coordinate the health check stations, and start the event. A SOMOS goal is to create a fun atmosphere that includes music, free hot dinner, and kids' activities so that the farm workers want to participate. The orchard owners encourage all of the workers to attend, and this adds to the atmosphere, allowing it to be an evening of fun and family rather than just being about health screenings. In 2022, SOMOS visited 3 orchards and screened 174 migrant farm workers, our first year returning after the pandemic hiatus. Next, Jasmine Hula Flores, the coordinator for our SOMOS program, is going to speak a moment why SOMOS is such a passion of hers.
I'm Jasmine Hula Flores, and I am the DEI supervisor at MCMC. SOMOS is very important to me because my dad's a farm worker and he has been his entire life. and he migrated when he was younger to different locations. So SOMOS is offering basic health screenings to migrant and seasonal farm workers. So when we offer these services, I think about my dad, and I think about how crucial and essential the health of farm workers are, and that's why I do SOMOS.
Community outreach is very important to Mid-Columbia Medical Center. Resolving health inequities is an initiative of our board. Patient navigation led to programs such as SOMOS, finding new ways to meet our community and meet their healthcare needs. To explain more about these programs is our CEO, Dennis Knox, Amy Sugg, Case Management Director, and of course, Jasmine.
Hi, my name is Dennis Knox, and I'm the President and CEO of Mid-Columbia Medical Center.
Hi, I'm Jasmine Flores, and I am the DEI Supervisor.
And hi, my name is Amy Sugg, and I'm the Director of Case Management at Mid-Columbia Medical Center.
This was a key ingredient to tackling health inequities in the community. And we started the patient navigation program with the help of Janet Amata and the next door. And it's achieved it's probably the biggest achievement of our initiatives that we've had.
Well, patient navigation was a result of the board directive and a strategic initiative. And patient navigation was very meaningful during COVID. It allowed us to have patient navigators to address access issues, address barriers to care, and outreach to patients who are not able to get to their appointments in time. It made a big impact on care in the Columbia River Gorge, and especially in rural areas.
It goes hand in hand because a lot of patient navigation is doing outreach to individuals and providing them health resources. And that's exactly what we did at SOMOS. We provided blood glucose checks, blood pressure checks, height and weight, and we had providers and medical assistants on site.
We have been very fortunate in Columbia Medical Center to have a very strong case management team comprised of nursing, social work, and patient navigation that has a three-pronged approach to reaching patients in our community. And we do a lot of outreach, providing access to care. SOMOS was a program that originated several years ago, but was on hold for COVID. It was restarted, and we have been able to reach out to migrants as a result of that program.
I was excited to be a co-coordinator of the program. I was also nervous because we were just, transitioning from not doing the SOMOS program for a couple of years. But ultimately, it was very positive. A lot of the orchardists were on board, and the people attending the event were very open and welcoming. So the community partners that were included was One Community Health, so the federal qualified health center here in the Columbia Gorge region. They offered diabetes education, and then we had the migrant education program that actually helped people, families enroll their children to our local child care services. And we had Oregon Health Authority, and they were offering COVID-19 vaccines. And we also had North Central Public Health District that offers sexual health resources.
Well, certainly we at Mid-Columbia Medical Center cannot meet all the needs of our community. So as Jasmine was saying, our partners are critical to delivering this care throughout the
We are excited to report that SOMOS, Serving Oregon and its Migrants by Offering Solutions, is the National Rural Health Association's winner of the 2023 Rural Health Award for Outstanding Rural Health Program. We are proud of this because all of the team members at Mid-Columbia Medical Center are passionate about care, passionate about this community, and passionate about meeting people where they are in order to help solve the health inequities that we are seeing in America. We appreciate you taking the time to learn more about our SOMOS program, and we look forward to serving our community in new and innovative ways. Thank you.